Hi, everyone. Sorry about that. It was all Gage's fault. Usually everything else is my fault. Thanks for your patience. So let's dive in. We have 1,457 confirmed COVID cases in New Haven, and unfortunately 53 fatalities. I wanted to share, give me just a sec here, the weekly update. On the breakdown of race and ethnicity and the heat maps with everyone. So these you've seen before. This is just the most recent update of these are COVID positive cases throughout the city. And you can see again, African Americans are impacted the most as far as our COVID positive data indicates, with the Latinx population being close second. And still a significant number of unknown, but that percentage of unknowns has gone down over time. This is COVID-related hospitalizations. The African-American community, again, is the largest percentage of COVID-related hospitalizations. And then finally, COVID-related deaths in the city. I will forward this to Gage and he can send this out to anyone that would like these graphs after the press conference. I wanted to make a quick note about the Small Business Association, SBA, and loans and business support that opened up at around 10 a.m. today. I sent out a robocall to all businesses in the Yellow Pages in New Haven about this. And this is as everyone knows, is a federal program, but the city wants to be very proactive about ensuring that our businesses can sign up for this program. So we've put a link onto our COVID website on the Together New Haven link. So it's pretty easy to find. It's City of New Haven and COVID website. You can just Google that up and then go to the Together New Haven link. And we also, as a part of the robocall, offered up a economic development phone number. And frankly, the line has been swamped with calls, which is an indication of the need and interest in the community into this program. We're happy to help in any way that we can to help our local businesses sign up for this program. A note about the PPP program: people should call their local bank to apply for that program. And this is the first time of the number of subsidies that the feds have put out that they're offering benefits to sole proprietors as well for unemployment benefits. And now I'm going to hand it over to Director Bond to give a nursing home update, and then Dr. Murphy to give an update on our site, which we have finally been able to finalize.
Good afternoon, everyone. So in addition to our situational awareness relating positive cases, we're also diligently working on tracking the nursing home cases within the city of New Haven. For Grinds, since my last report, we have now a total of 60 residents that have tested positive at the Grind Center, and one additional employee that has tested positive, totaling 19. For Mary Wade, we have 15 total residents within the Boardman residential site, with also the Kimberly site, the skilled nursing facility site, of 29 positive cases, and also a staff of 24, of which 4 are non-clinical. And so we are continuing to track all of our nursing home cases. In regards to Regal Care, we have also seen that we have a total of 29 residents that have tested positive, with an addition a staff total of 13. which means that the change since our last report is 4 more confirmed cases at the Regal Care. Advanced nursing is now, we're seeing an increase. We have a total of 9 residents and a total of 5 employees. And so we have seen a jump of 7 total residents since my last report. They were inspected. The advanced nursing home was inspected this past Sunday. And according to the notes that we have from the Department of Public Health, they are following the proper protocols and procedures. And our health department will continue to closely monitor and provide surveillance for each of these nursing homes as we continue to monitor this pandemic. And then at this time, I'm going to turn it over to Dr. Murphy to talk a little bit about our testing site and the collaboration between the New Haven Health Department and his practice.
Can I tee this up, Dr. Murphy, for you?
Absolutely, that'd be fantastic, Mayor.
So as folks that are on this call pretty much every day know, we've been working hard to increase our ability to do testing, particularly in hotspots around the city. And as people will recall, there have been these 2 sites, the Yale New Haven Hospital site and the CVS site, which have done a ton of testing already. And then through our collaboration with the Fairhaven Health and Cornell Scott Hill Health Center, we've stood up these additional 2 sites. With Dr. Murphy, we've been working hard to negotiate with a property owner. We wanted to have a site at the Stop and Shop Plaza, and we've been negotiating for quite some time with the Greater Dwight Development Corporation, but we're unable to come to an agreement. And so we've decided to do this new site at the corner of Day and Chapel Street. And it's a site that the city owns, and we've just activated the site this morning and are likely to go live, I believe, on Wednesday. I'll defer to Dr. Murphy and Director Bond to confirm that. It's going to be at this basketball court that folks in New Haven are probably familiar with, behind the Amistad Academy building in Chapel Street. And it's at a site where we're seeing a lot of activity around COVID-19. So we're very grateful that Dr. Murphy has been flexible with us as we've worked to find a site in one of the hotspots in the city, and are very optimistic and expect this site to be well used, just given how much interest there's been on the other 2 sites. In our group call today with our partners, both Fairhaven Health and Cornell Scott said that they had incredible amounts of interest in both of their sites. Fairhaven said they had 50 people that they served on Saturday, and there continues to be strong interest in both sites. So I'll hand it over to you, to Dr. Murphy, and thank you again for all your help and support in getting us this far.
Thank you very much, Mayor, and thank you very much, Director Bond. I can't begin to emphasize how instrumental the city has been in being able to deliver quality care to our patients in our underserved communities. We're very excited to announce the opening of our 3rd testing site in New Haven as a walkthrough testing site located at 1319 Chapel Street here in New Haven. We'll be open between the hours of 8 a.m. and 4 p.m. Monday through Friday. So we're very excited about that. The most important thing we want to tell all the residents is that they're going to need to register online at our website. The website is coronatestct.com. That's our website right there, coronatestct.com. It's very important they submit their registration forms and fill out all 3 forms, as well as present their insurance card, whether they have Husky or Medicare or Medicaid or any other payer. In addition to those payers, we also will take any patient who does not have insurance. Those patients will not receive a bill. There will be no cost to them, but we'll need to register them. So it's important that they bring a form of identification with them. In addition to that, they can send us or email us their identification to get the process jump started. We will require that patients pre-register on our website, so that way they can be assured a spot at the walkthrough. Should you not have internet connection, you can call the New Haven Department of Public Health at 203-946-4949. That's 203-946-4949. 4949. We're very excited to serve the community here. We know that this is an underserved area where we need to get our hands around the coronavirus here and prevent its untoward effects, especially as we can see with the data that the mayor presented in regards to hospitalizations. So we want to keep you healthy and hospital free.
Thank you, Dr. Murphy. Really appreciate that. And am I right in that we're looking at Wednesday as the start date? Is that right?
That is correct. Wednesday, we will start at 8 a.m., Mayor. Thank you.
Okay. I don't have anything else to add. Jennifer, did you have something to add?
Yes, thank you, Mayor. So just to
Can you introduce yourself too?
Oh, I'm sorry. I'm Jennifer Alice Vasquez. I'm the Director of Public Health Nursing for the City of New Haven Health Department. So to echo what Dr. Murphy and
We lost you, Jennifer. I'm not sure if you can hear us.
So I'll jump in. I think it sounds like we lost our connection here with Jennifer, so I apologize. What Jennifer Vasquez, Dr. Vasquez wanted to announce is that she's working closely with public health nurses through our COVID-19 hotline. And for individuals that may not have insurance coverage, insurance coverage, that may not have internet access, our hotline are able to assist with scheduling appointments so that we can be able to assist you on Wednesday. So we are inviting individuals to please call us at 203-946-4949 so that you can be able to get assistance in scheduling your appointment. It's really important that we, as we continue to ensure that we provide access to testing, that we are also available through our hotline for the community so that they can get assistance with scheduling an appointment for our new site. And so we're really excited that our public health nursing department are able to provide that service.
Thank you, Director Bong. Sorry that we missed Jennifer's opportunity to share that. So I don't have any other updates. Does the press have any questions? Go ahead, Paul.
Thanks, Justin. I hope everyone's doing well. My first question was for Dr. Murphy, and thanks for opening the site. Are you a for-profit or nonprofit entity? Who is running this, and how do you pay the bills?
Yeah, I could say with my credit cards, right? So I am self-funded, right? So I currently am a private practice in Fairfield County, and we've opened a site here in New Haven. As I said, I think the other day, I was born in New Haven, so this town is, the city's very special to me, and we want to be able to extend those services in New Haven. So we are self-funded, and we fund ourselves. In addition to that, we have applied for the loans, as everyone else can imagine, to help us be able to deliver these services.
In other words, you're allowing people who don't have insurance to come, and you're not going to charge them, but otherwise you'll be reimbursed by the payers.
Correct, absolutely.
All right. I can wait to ask my other questions, Justin, until others.
Go for it. I don't see any other questions yet.
Okay, as you know, folks, we've all been reading, governments at every level are trying to figure out how we're going to reopen based on some still unknowns, like about how reliable antibody tests are. I know you have a group working hard. I know it's too early to know any specifics. Have you agreed on any guiding principles that will guide our reopening New Haven?
I think that speaking very high level, first of all, we've been thinking a lot about what this looks like. And the guiding principles are appropriately balancing health and the economy. And I think that the most important thing for us is to make sure that we are on top of ensuring the health of residents, and that we need to be humble as to how we approach this. We need to do this with our partnering towns and the state, because if one of us does something but another one does not, we could be inadvertently impacting the community at large. It's interesting thinking about how we close things down. It wasn't necessarily a bad thing from the health perspective if someone was more aggressive than someone else about closing things down, right? But opening up, I think, is very much the opposite. If one community in Connecticut opens up significantly and the other doesn't, well, that community could promote an outbreak. And as people know, there's many people in the surrounding suburbs of New Haven that will work and shop in New Haven, and so that will impact us. So my hope is that we will be more collaborative in the way that we open up, do so very thoughtfully, and also that our residents will be open to this idea of the faucet, where we may open up a little bit and decide to have to close down a little bit again if there is an outbreak in the virus. We're talking internally in City Hall about different strategies that we need to use to approach opening up. And there's a number of angles to this. One is the obvious of supporting businesses opening up. And I think that can come in a lot of different forms. Our role can come in a lot of different forms in educating businesses about how they can conduct safer practices, and supporting businesses one by one in keeping their employees safe, different strategies for cleaning, say, equipment that might be jointly used. And then the second area is we're talking about ways that the city might help on the infrastructure side. For example, exploring ways that we might help support businesses in installing plexiglass or a takeout window, or different ways that they can inch towards opening up with some additional infrastructure. The third way is by advising businesses on what opportunities that already exist out there and will expand. And an example is there's some businesses that have requested to be declared an essential business. There was an article in the New Haven Independent about Hulls being one of these businesses. We've put out through our networks the application process so that we can support the businesses having the opportunity to reach out to the governor's office and get an exemption so they might be declared an essential business. That's a whole, this is a long-winded answer to your question, Paul, but that's
what I was looking for. Thank you.
That's a whole category. There's a separate category of how City Hall begins to open up. And again, the most important thing is keeping our staff and customers, the public, healthy and safe. But we're starting to do this even already. The parking enforcement officers, for example, when this began, we shut down many operations in City Hall. And now that we're more familiar with the virus and ways that we can help protect people, we're putting in place ways to make sure that, to use the example of parking enforcement officers, we're able to keep them safe and conduct city operations, cleaning the equipment that they use, the ticket printers that they hold when they're walking around, making sure that they have masks. Town Green has been great about actually going around and spraying down the parking meters to keep them clean. So that's an area that we're looking to open up this week and next week. And as we've mentioned over the weekend, this week we'll be giving out warning tickets, but next week we'll start to give out parking tickets again. We're looking to do something similar with our street crew. So in Public Works, the refuse crew has been out, but the street crew is not. And we're also looking or exploring ways that we can make sure that we're keeping our other staff safe. And so this is all, the strategy is slowly inching into this and making sure every step of the way we're cautious so that we have public confidence, so that we're keeping our employees safe. At the end of the day, opening up is really critical because the federal subsidies at some point are going to run out. And it's the economy, businesses actually employing people and making money that is going to drive our comeback. And so we want to make sure that we're doing that as quickly as possible, but also as carefully as possible.
People make a lot of historical parallels to what you're facing, like Mayor Murphy during the Great Depression. Have you read up or done any kind of thought about what any of your predecessors, different point in New Haven history, dealt with and how they did it?
No, but I should. If you have, I know, Paul, that you have read a lot of history books about New Haven. If you have any suggestions, I'm always happy to.
Mayor Murphy and the Great Depression, because that's what you're going to be facing next. We had an excerpt on it in the Independent. Yeah.
Thanks.
Thank you very much.
Other questions? Mary, do you have a question? Any questions? Any questions? We'll go back to Paul.
I apologize. Don't mean to hug.
Don't worry about it.
Marissa talked about 4 new deaths in the last 2 days. Can you give us any details, age, conditions?
Good afternoon. Yeah, so our case fatality rate at this juncture, based on our positive cases, I'm just opening up the page really quickly. Is at 3.6% overall from our positive cases. Our youngest is 26, with our oldest being 99, and our average being 75. So in the last few days, our cases, case fatality rate, are all elderly individuals within the last few days. So we had as 89 and 72. So it's a range between the elderly population.
Was the 99-year-old in the last 4 days?
No.
Yeah, I think I know who that is, but yeah, okay. Thank you for that information.
You're
It was last week,
Mhm.
a 99-year-old.
Other questions? There's got to be one other question other than Paul. Going once. Paul's got another. Go for it.
I'm sorry, I'm just wondering, I've been thinking a lot to be in your guys' position to know the decisions you make do to some extent determine whether people live or die, and that it's impossible to always make the right decision. Has this been weighing on you in that way? Is there any way you guys talk to each other to support each other in that?
I mean, I can take the first stab at it, and then maybe turn that over to anyone else that wants to comment. I personally feel like in the beginning of this, there were many more decisions that we needed to make that were along the lines of who might live or who might die, right? Because or not who, but how proactive we needed to be to reduce the number of deaths. And you saw that because we were seeing what was happening in Italy, what was happening in New York City, that the faster we shut things down, the more likely it is that we would save lives. And so the urgency of the decisions that we were making, I think very much were reflected in the number of hours we were working each day, the level of tension, the sense of purpose, and particularly in the first couple of weeks of this crisis, there was a pretty heavy weight on everyone, because we knew just how important that period was to what semantics, or what we call flattening the curve, but in reality is people's lives. And over time, I think that as our communities started to know the people that have died, it's become much more real, just why the work in the beginning was important. And I try to call, as we find the next of kin information, the loved ones of people who have passed away. And, every once in a while, there's someone that I know, and that, it's obviously a very, very difficult thing for our community. And Paul, you've had some articles that have come up about people that we've lost, leaders in the community for many, many years. And I think that now the proactiveness is about making sure that we have the situation more under control. But in the beginning days, it felt much more important to act quickly, and that if we made a mistake, we might risk people's lives.
Well, as you face that again with the opening, I appreciate, just think we all thank how hard you're all working and hope that you're able to hold up in the next round.
Yeah, and I think that the challenge with the opening is there's going to be a lot of pressure, um, understandably, to open.
Mhm.
And we're seeing with this conversation about opening around the nation that it's also a little bit too political in my mind, that generally more Republican leaning individuals are pushing for faster reopening than Democrats. And that concerns me because this should be based on data, and we should be deferring to the epidemiologists, the medical experts on the best strategy to do this rather than on political pressures. And I hope that the leaders around Connecticut will uh, have a steady hand when we make these sorts of decisions. Director Bond, do you want to add anything?
I think, I concur with what the mayor just shared, and I just want to add that when we were strategizing our first 100 days in the city as a new administration coming in, COVID-19 clearly became the priority because of this pandemic. And I just want to commend the efforts of our leader, our mayor, who really has been very level about his response and not reactive way of thinking, and it has made this process so much easier for us as a team when we're all looking at this from different angles and different perspectives. And so, just being able to have a leader that can really just take into account a lot of the global efforts that went into play, and just being able to be proactive, that has been very instrumental. So when you ask the question about how do we, collectively function in the burden that we take on as a city, I think that's been really helpful, is just making sure that we're working as a team to really address um, this pandemic as a community, and really working together with other external partners to really make, progress on, trying to mitigate this pandemic.
And I will say, Paul, that, from time to time, I think about, is there something that I could have done differently? It's just thinking about the number of deaths that we're seeing in nursing homes. Is there something that the city could have done differently to reduce the number of people that died? And I think that we all can look back, and later on, many of us will realize that there could have been other things, different strategies that we might have adopted to reduce the number of deaths. And I think that will be hard to come to terms with. And
Yeah.
I think that's something we'll struggle with.
Doing your best.
So true.
Other questions? Okay. Thanks, everybody. We'll see you soon.
Thanks, Mayor.
Take care.